If you have Original Medicare, meaning Medicare Part A and Part B, you already know it covers a lot. But what most seniors do not realize until they get a medical bill is that Original Medicare does not cover everything. There are gaps. And those gaps can cost you thousands of dollars out of your own pocket every single year. Things like your 20% co-insurance after Part B pays its share. The hospital deductible that resets every time you are admitted. The daily costs if you stay in a hospital for more than 60 days. These are real expenses that real seniors face every single day. And for someone living on a fixed retirement income, these unexpected bills can be absolutely devastating. Today we are talking about the plan that was specifically designed to fill those gaps. It is called Medigap, also known as Medicare Supplement Insurance. By the end of this video you will know exactly what Medigap is, how it works, which plan is right for you, and the one enrollment window you absolutely cannot miss. And before we get started, if you find this helpful, please tap the like button. It helps other seniors who need this information find this video. Let us start from the very beginning. What exactly is Medigap? Medigap is a supplemental health insurance policy sold by private insurance companies that works alongside your Original Medicare. It is called Medigap because it literally fills in the gaps that Original Medicare leaves behind. Here is the simplest way to understand it. Think of Original Medicare as a rain jacket with some holes in it. Most of the rain, meaning most of your medical costs, is covered. But some rain still gets through those holes and soaks you. Medigap is like a second layer underneath that catches everything Original Medicare misses. When you have both Original Medicare and a Medigap plan working together, Medicare pays its share of your medical bills first. Then your Medigap plan automatically pays its share of whatever is left over. In many cases you end up paying zero out of pocket for covered medical services. That is the power of having a Medigap plan. Medigap plans are sold by private insurance companies, but they are strictly regulated by the federal government. This means that a Plan G from Humana covers exactly the same things as a Plan G from Aetna or Blue Cross. The benefits are standardized. The only difference between companies is the monthly premium they charge. So when shopping for Medigap, you are simply looking for the company offering the lowest premium for the exact same coverage. Now let us talk about the different Medigap plans available. Medigap plans are labeled with letters: Plan A, Plan B, Plan C, Plan D, Plan F, Plan G, Plan K, Plan L, Plan M and Plan N. Each letter represents a different level of coverage and a different price point. I know that sounds overwhelming, so let me simplify it down to what actually matters for most seniors in 2026. The most popular and most comprehensive Medigap plan right now is Plan G. Plan G covers almost everything Original Medicare does not cover. It covers your Part A hospital deductible. It covers your Part A co-insurance for extended hospital stays. It covers your Part B co-insurance, meaning that 20% you would normally pay after Medicare pays its 80%. It covers skilled nursing facility costs. And it even covers medical care when you travel outside the United States. The only thing Plan G does not cover is your Part B deductible, which in 2026 is around $283 per year. You pay that once a year yourself, and then Plan G covers everything else for the rest of the year. For most seniors, Plan G is the gold standard of Medigap coverage. Yes, it has a higher monthly premium than some other plans. But in exchange you get the peace of mind of knowing that almost every medical bill you receive will be covered completely. No surprises. No unexpected thousands of dollars in bills. The second most popular option is Plan N. Plan N has a lower monthly premium than Plan G but requires you to pay small copays of up to $20 for doctor visits and up to $50 for emergency room visits. If you are relatively healthy and do not visit the doctor frequently, Plan N can save you money compared to Plan G. Now let us talk about cost. Medigap premiums vary significantly depending on three things: which plan you choose, which insurance company you choose, and where you live. There is no single fixed price for Medigap the way there is for Medicare Part B. As a general guide, in 2026 a Medigap Plan G premium typically ranges from around $100 to over $300 per month depending on your age, location, and the insurance company. Plan N is typically cheaper, ranging from around $85 to $190 per month. Now you might think that sounds expensive on top of your Part B premium. But here is the way to think about it. Without Medigap you are exposed to potentially thousands of dollars in unexpected medical bills every year. One serious illness. One hospital stay. One major surgery. And you could easily face $5,000 to $10,000 in out-of-pocket costs. With Medigap you pay a predictable monthly premium, and in exchange you are protected from those devastating surprise bills. For most seniors that predictability and peace of mind is worth every single dollar. Here is the most important thing I am going to tell you in this entire video. Medigap has a special enrollment window called the Medigap Open Enrollment Period. This window opens on the first day of the month that you are both 65 years old and enrolled in Medicare Part B. It lasts for exactly 6 months. During this 6-month window, insurance companies are legally required to sell you any Medigap plan you want at the best available price regardless of your health conditions. They cannot reject you. They cannot charge you more because of pre-existing conditions. They must accept you and give you their standard rate. This is called guaranteed issue rights, and it is one of the most valuable protections available to Medicare enrollees. Here is what happens if you miss this window. Once your 6-month Medigap open enrollment period closes, insurance companies can use medical underwriting to evaluate your health before selling you a plan. They can reject your application entirely based on your health history. They can charge you significantly higher premiums because of pre-existing conditions. Or they can exclude coverage for certain conditions you already have. This means that missing your Medigap enrollment window could result in you being unable to get a Medigap plan at all, or only being able to get one at a price you cannot afford. Sign up during your 6-month window. Do not wait. Here is something that surprises almost every senior when they first hear it. Medigap plans do not include prescription drug coverage. Even the most comprehensive Plan G does not cover a single prescription medication. This means that if you choose Original Medicare plus a Medigap plan, you still need to add a separate Medicare Part D prescription drug plan on top of everything else to cover your medications. That is 3 separate plans working together: Part A, Part B, your Medigap plan, and a Part D drug plan. This is completely different from Medicare Advantage, which we covered in our last video. Medicare Advantage bundles everything into one single plan. Original Medicare with Medigap requires you to manage multiple plans separately. Neither approach is wrong. They are simply different. What matters is understanding exactly what you have and what you are missing, so you are never caught off guard by an unexpected bill. Let us do a quick recap of everything we covered today. Medigap, also called Medicare Supplement Insurance, is a private insurance plan that fills in the gaps left by Original Medicare. It works alongside your Part A and Part B to cover costs like your 20% co-insurance, hospital deductibles, and extended stay costs. The most popular plans are Plan G, which offers the most comprehensive coverage, and Plan N, which offers slightly less coverage at a lower premium. Premiums vary by plan, company, and location. And most importantly, you must sign up during your 6-month Medigap open enrollment period when you first turn 65 and enroll in Part B, because missing that window could mean being denied coverage permanently based on your health. If this video helped you understand Medigap more clearly, please give it a thumbs up right now and share it with someone you know who is approaching Medicare age. You could genuinely protect them from making a very costly mistake. Subscribe to Medicare Made Simple for a brand new Medicare guide every single day. Tomorrow we are covering the Medicare enrollment periods, the specific windows of time when you can sign up for Medicare, make changes to your coverage, and avoid the lifetime penalties that come from missing deadlines. That is a video that could save you thousands of dollars, so make sure you do not miss it. I will see you in the next one. This video is for informational purposes only. It does not constitute medical, legal, or financial advice. Medicare rules, costs and plans change annually. Always verify current information at medicare.gov or speak with a licensed Medicare advisor for your personal situation.